If you've had an injury to your ACJ, depending on the severity, you might be heading towards an operation, or you might manage non-invasively with exercises. But which is the best route to take? Well, a research paper might just change the recommendations on this. The normal recommendations of whether an AC joint injury would need surgery is based on Rockwood classifications, which is split into 6 types. Type 1 would be a sprain, and type 2 would be an AC ligament tear, but with the other ligaments still intact. And these 2 types generally would be managed through rehab and non-invasive measures. And then anything beyond that, so type 3 to type 6, would be managed surgically. However, this research paper looked to see if type 3 and type 5 are better managed non-invasively or with an operation. So it was a randomized controlled trial, so good quality data, with 124 patients included who had acute injuries. So treatment started 3 weeks after the injury, and they were placed into either the non-operative group or the operative group, where they'd be treated with a hook plate, and the patients were followed over 2 years to see the difference in the outcomes for each. With all dropouts, they got data from 118 people, the main outcome measure being the constant score, which is one of the most commonly used for assessing the outcome of shoulder treatments. It's a 100-point scale that's used to define the level of pain and the ability to carry out normal daily activities, basically what you'd want a shoulder treatment to be helping with. They measured at 3, 6, 12, and 24 months to see differences, which you can see on this graph here. And what they found was by 12 months, there was very little difference between groups, which followed through to 24 months. One of the biggest differences, though, was at 3 months, it showed that patients in the non-operative groups had significantly better scores than those in the operative. But then following that at 6, 12, and 24 months, there was no significant difference. They also looked at pain scores at rest and when moving, and the operative showed slightly less pain with movement compared to the non-operative at 24 months. But it goes to show they all still had some slight pain with movement even 2 years later. So what does this mean if you've had an AC joint injury? Well, it means you definitely need to get it checked out, especially if related to trauma, to determine what grade it is. But then if it shows that it is a type 3 or 5 and you're offered surgery, you likely get just as much benefit if choosing a non-operative management, which will come with much less risks of things like infection, which did happen to one person in the study from the operative group. If you've just got a type 1 or 2 injury, then we have a video with exercises you can follow to help here. However, if it is a higher grade and you're choosing a non-operative approach, it'll be a good few weeks before you'll be able to do those. And you'd definitely be wanting individual management following a plan from a physio anyway, especially in that initial 6 weeks of treatment.